So I'm here with Eero Meerilind from the Nômne Healthcare Center, a beautiful new built center which has been there for a year, 1,100 square meters, about 12,000 patients, 6 doctors, 12 nurses, and all kinds of other things. And I'm going to ask him, how does he organize it? Eero, beautiful center. You've been here for a year. It's been here for a year. How many people work here, and what kind of positions do they have?
We have several people in our family healthcare center. We have 6 family doctors, 12 nurses, a physiotherapist, we have midwife, district nurse, healthcare manager, receptionist, and psychologist also. And
a psychologist, yeah. So that is really nicely integrated teamwork. How many appointments do you do per month?
Per month I cannot say, but I do every day 15 to 20 appointments.
Yeah, you said 2,600 for the 6 doctors and 5,000 for the nurses, right?
Yeah, 2,600 for all doctors together per month, and 5,000 to the nurses.
Yeah, and the healthcare system in Estonia is that you get a lump sum per person depending on the age and some other things, but you don't get paid for an individual visit, right?
Yes, it's correct, but we call it like payment per capita. Yeah. But the budget or the contract with health insurance funds is much more complicated, and we get some different money for premises, we get money for payment for performance, we get money for investigations, and it's about 8 to 10 possibilities to get money. If you do more, you will get more.
Yeah, but if you see a patient just because this person wants to have has a healthcare problem, you don't get paid for that.
No, it's a free for service, and it means the patient does not pay for visit payment to the family doctor.
Yeah. You said that the 5,000 appointments per month for the nurses, they have a reasonable amount of video or call-in, that kind of stuff. What percentage is the virtual versus the physical?
I think, it's about 60% they still do. We will still do face-to-face consultations, and maybe 40% are coming telephone consultation, and we are not much doing video consultation, but the telephone consultation and internet consultation.
Okay, and what is internet consultation?
Internet consultation is we are using this artificial intelligent system. The patient can write to us, and then we can see what's the problem.
Yeah, you do a self-diagnosis based on that. The system is asking you a question, and then basically gives a diagnosis, and that's what the nurse looks at.
Yeah, what the nurse look like, and there are also some possibilities to renew a prescription, or to start with a sick leave, and to close the sick leave, and ask some questions about the laboratory tests, and the nurse can answer them.
Yeah. And you, of course, because you don't get paid for per visit, you want to make it efficient, right? Because, I mean, there's a shortage of doctors. Every doctor has 2,000 patients. And how long does it take to make an appointment from directly now to a couple of weeks? What does it depend on?
It depends on your health status. It means if you have some urgent problem, you can have appointment to see nurse the same day. Or if you're very urgent, you can even see the doctors the same day. Yeah. But if you have a routine appointment and you don't want to push your appointment, it's a waiting time about 2 or 3 weeks.
Yeah, you can go to the website and say, I want to have this slot, but the slots are only available 2 or 3 weeks away. Yes. But otherwise you can call the nurse, you can call the receptionist, or you can do the self-diagnose, and then the nurse will look at it and say, come now in.
Yes, you are correct.
Okay, so there's a really good triage system. There's about 4 digital systems you're using, right? You have the national system. What can you see in the national system?
Yeah, the national system, I think it's more as 13 years now we are using, and we started with digital prescriptions, and now I think 99% are digital prescription in Estonia. Then it came the central system. It means you have one big central system, and you will send all your medical information to the central system, and you can collect through the system all the information.
X-rays, laboratory tests, everything you can see.
Yeah, I can see every laboratory test, every X-ray, ultrasound, everywhere the patient has done it before.
Yeah. And that works very nicely. So that's one system, and that works quite good. 13 years old, and it's now essential.
No, they are trying to repair it. Yeah, of course, sometimes it's not working, but usually maybe 1 hour is not working. But in the whole year, it's working. Sometimes it's much slower. Sometimes it's quicker. It depends how many doctors are working at the same time.
Yeah. And then 95% of the doctors are using the appointment system to plan the day. But the nurses don't use that system, right?
The nurses using also the same system, but it's not possible to book appointment online to see the nurse. Oh. But in our healthcare center, they still have some routine appointments, and you can book appointment, but through the receptionist.
Yeah. And then you have the medical information system from the healthcare, from your healthcare, and that imports information out of the national system and exports it back, right?
Yes, you are correct. Yeah, that's correct.
And what can you see in the medical healthcare, in your own medical healthcare system, what you don't have in the national system?
No, I see in my system only the patient's history or the patient problems that I visited myself. Mm-hmm. But if I want to see something more, for example, operations or blood tests from hospital or ambulance information or patient I visited out of our system at hospital, then I go to the central system. Mm-hmm. And I can open the central system information.
Yeah, so you have local system and the national system. Yeah. And then the fourth system is that artificial intelligence system, the self-diagnostic system. It asks questions and you can put in photos and things, and that comes to you, and that is that better than an email that the patient says? Is the artificial intelligence also already, the self-learning already working?
Yeah, we like this self-learning system, and last month we had about 1,000 appointments through this system, and the patient rapidly starting to use it more and more. Mm-hmm. And I hope it is a future, but yeah, there's some advantages if you write email or if you want to write to artificial intelligence system.
Mm-hmm. Much more structured.
Yeah, it's more structured, and there is just one conclusion. With the email, you can have several emails back and forward, and you still can have decision. Okay. But this artificial intelligence system always ends with decision. You need to see the doctor. You don't need to see the doctor. You need to see the nurse. We have a renewed prescription. And
who makes that last system?
This makes a nurse.
No, the artificial intelligence.
Yeah. Okay, artificial intelligence is also one Estonian company. Okay. It's starting several years ago. And I hope it's a big future in the future also.
Yeah. But already 1,000 appointments out of 8,000. That's already, yes. It becomes very, and it's only 1 year old, so that's very significant. You said there was shortage on doctors, but especially on nurses.
Yeah, it's big shortage of family doctors. We still don't have a family doctor everywhere in Estonia. Mm-hmm. It's also a shortage of nurses, but now we luckily work in big cities. But in big cities we still can have nurses, but in rural areas also it's a problem to find a proper nurse.
Yeah. Okay, so it looks extremely comfortable. You have from university, you already have started this healthcare center. It's your healthcare system with 2 other doctors, right? Mm-hmm. And you like this working together in a team and to do it multi-dimensional. Yeah.
Yeah, I like this, and this is also one reason I have chosen the family doctor system, mm-hmm. because if you would be like a specialist, you still have some head and several heads. Yeah. But here you can decide by yourself, and you know what's better for patient, what's better for staff, and you can organize the work in better way.
Wonderful. Next to that, you also have a lot of other jobs you do, and you have been chairman of the Family Doctors Association. What kind of organization is that?
Yeah, I'm a chairman of Estonian Health Foundation, and we have next week a big conference about the men's health. And
Men health.
yeah, men health. If you are here, I want to invite you. But but it's quite interesting work. Also, is like voluntary work. We are speaking about men health. We are speaking about accidents and traumas in small children. We are speaking about how to reduce smoking. Why smoking is not very good. We have different topics and this healthcare.
How many doctors are a member of that?
We have like advisory board. In our advisory board, we have more as 15 doctors in different areas, and we are discussing.
But how many people are member of the organization?
It's non-governmental organization. We don't have a members. We are just advisory.
You do advisory, and you basically organize events, and you basically come up with reports.
We organize events. We are speaking in different topics in publicity, and we have some conferences. We have some workshops.
And do you also advise the government? Are you also in all kinds of work groups to say, hey, the next level, the next version of the healthcare system should do this or this?
Yeah, this is also part of Estonian Family Doctor Society. Yeah, I've been a board member last board member, but now I'm not a board member because I built this building. But I still active in this Estonian Family Doctors Society.
Okay. Thank you very much.
Thank you. Have a nice day.
I will.